Myxomatosis. So the occurrence, there are serotype 1 and serotype 2. Serotype 1 is a virulent strain which was first detected in Uruguay and it spread across North and South America. Serotype 2 is an attenuated virus strain that spread across the UK and Australia. It replaced serotype 1. In the EU, serotype 1 and 2 occur parallel to each other. The etiology is the myxoma virus is a part of the Leporipox virus genus. They're serotype 1 and serotype 2. So for the epidemiology, it's a B-list notifiable disease. And the original host was a cottontail rabbit. It is more resistant and it's asymptomatic or has a respiratory infection. There's a local infection and no viremia. In the European domestic rabbit, there's more severe signs. It has a high mortality. And in hares, they're not susceptible. They're asymptomatic carriers. The infection can be spread through asymptomatic or carrier rabbits. The mechanical vectors are mosquitoes, specifically the green fodder mosquito. They're seasonal. The virus can also be spread through direct contact in breeding or mating, but this is rare. There are also aerogenic lower virulent strains, and there's lifelong immunity. So the pathogenesis of the disease. Once the animal is infected, the primary replication happens at the site of entry, which is usually the skin, specifically at the histiocytes, specifically the myxoma cell. Here we have hydropic degeneration in the epithelial cells and the endothelial cells. This leads to serous fluid accumulation and it generalizes and causes viremia. And this causes damage to the blood vessel endothelium. And it returns to the skin and mucous membranes and creates moist skin nodules. It's called myxoma cell proliferation. They're tumours. They're edematic swellings. And the predilation sites are the ears, eyelids, nostrils, and mouth. So for the clinical signs, there are two forms. The general clinical signs are anorexia, lethargy, and nasal discharge. The incubation period is 7 days, and it's typically referred in linehead disease. This refers to edematic swelling around the moist nodules and leads to flu-like symptoms. The edematic swellings around the ears, eyelids, nostrils, and mouth. It can also cause skin necrosis and ulceration, and there's death at day 10, and it's 100% mortality. The second form is the atypical form. It has myxomatosis and conjunctival. These are low virulent strains, and they have respiratory signs, such as sneezing, coughing, and nasal discharge. And the myxomas are less or none. For the pathology, the skin lesions, the myxomas, are the most important. The histiocytes are infiltrated by mucus due to the intracytoplasm inclusion bodies. This is due to the guarnary viral polymerase. And for the diagnosis, look at the clinical signs and histology. For isolation, you look at the rabbit kidney cells, and you can do PCR, ELISA, and IF. For control, it's a notifiable disease. It's important to follow the general epidemiology measures and try and eliminate the green fodder mosquito by doing insect control. If there's an outbreak, stamp out, have a protective zone, and isolate healthy individuals and vaccinate them. The vaccine is an attenuated myxomatosis vaccine, and you administer before the mosquito season, so before the spring or the summer. The virus has also been used as a biological weapon to thin the rabbit population in Australia.